Hey, Dr. Matt here. So, how long does it take for your iron pills to work? You're taking those supplements, you want to see your iron levels go up, you're feeling like, man, I got all the symptoms. What do you got to do? How long does it take? So, much of the answer to this question really lies or comes down to, why is your iron low in the first place? Why is your ferritin low in the first place? If you've had acute blood loss and that's been taken care of, you're not losing blood anymore, then generally off the cuff, you should pretty easily, pretty consistently get at least 5 to 10 points via oral iron supplementation on a monthly basis. It just goes up every month. Usually more towards the 10 point is what I would see, or even up to 15 points. But remember, your ferritin is a storage hub for iron, so it will go up slower than your serum iron level on your blood test, or your iron saturation on your blood test. So don't get befuddled if your ferritin isn't just going through the roof right off the bat, even though your iron or iron saturation is. Once your body has filled up that transferrin pool, and transferrin is really that marker, that serum iron marker, because transferrin is a protein that circulates iron around through the blood for cells that need it, for cells that need the iron. Once that transferrin pool gets filled up, then the body will start spewing iron, putting it on the ferritin protein for later use and for storage. But it's not going to do that, until your serum iron levels get filled, or transferrin levels get filled. So maybe you're iron deficient. You see that you're low ferritin. You start an iron supplement. You get your labs back. After a month, 2 months of supplementing really faithfully, and you find that, whoa, your serum iron levels have increased dramatically. This is awesome. And maybe even maybe it's even gone out of range, your serum iron levels. But your ferritin, it's only gone up marginally, just a couple points. Oh my goodness, what is going on? Compared to the big skyrocketing of that serum iron, I will say, do not worry. more than likely, your body was just in a heavy need state. It'd been depleted for a while. It was in a heavy need for iron state. And so it's putting all that iron you're uptaking, it's put into use. And so that'll show up in your blood panel, as a lot of iron being transferred via that transferrin molecule in the blood. And this level, this will level out as you become more iron sufficient. And you'll see that your iron level, actually that iron, serum iron level, will actually start coming down and normalizing, and your ferritin level then will start going up like you're hoping it will be. Because no doubt, if your ferritin's low, chances are you're struggling with low iron levels. So for example, I had a 30-year-old female with a ferritin of 9. And now optimally, we're shooting for like 50 to 70 for most people of a ferritin level where they're really thriving in life. And this woman, after 3 months, her ferritin went up to about 21, but her iron levels went up to 172. And about 170 micrograms per deciliter is actually the top end for serum iron. So she was over that top end. However, I just checked her levels last week, and her ferritin is now at 160, and her serum iron is at 98. So it's like they flip-flop. And that is because, she now has enough iron in store. She now has enough iron in stores, and she feels fantastic because her serum iron, like the iron she needed for any given moment, was now sufficient for her cells. And her having taken the iron consistently, it just brought her ferritin right up. So don't get out of sorts. I see it all the time. People get out of sorts by having their serum iron levels go up right away. Like, oh my goodness, I have too much iron. I'm an iron overload. I'm gonna be like, all these free radicals everywhere. I'm oxidizing. This is not good. It's toxic because I'm on poison. It's not. If you're iron deficient and your serum iron levels go up, that's just a sign that you were iron deficient and you need rapid uptake. You need iron right now, so the body's putting it straight to use. Once it's put in use, your transferrin is all the little people in the transferrin bus are there, then your ferritin will start going up, and you'll build those stores up, and you'll start feeling consistently better with your iron levels, your energy levels, maybe your hair stop falling out, maybe you get joint pains or just feeling weak, wake up in the middle of the night, those kind of things, they should all just go away. So if you want to get back to life, you got to get your ferritin levels up to normal. And if you want to get your ferritin levels back up to normal, you got to take your iron consistently. You can't just be like, oh, my serum iron's higher, I must be good to go. I'm telling you, you're like teetering right on the brink there. So I give that example. I get this example often because between practitioners and patients who just get freaked out that they have way too much iron, that oxidation is going to be happening, that their hearts, their brains, they're poisoning themselves with iron. But the body is so much more intelligent than we are, and it knows that first it's going to transfer all that iron, it's going to get all that transferrin. And as that level finally levels out, then and becomes sufficient, then it can. If the iron deficiency is now clear, now it can start putting it into the ferritin molecule, and you can start building up your actual stores, which itself will give you that, like I said, a balanced state where you're not going one day you feel good, one day you don't feel good. So there's a few factors that make up optimizing iron, and I would say probably the biggest one out there is really the menstrual cycles for females. If you have a heavy menstrual cycle, or your menstrual cycles are really close together, and this causes maybe you got fibroids, which cause a lot of blood loss at a faster degree, basically, than the body can recoup it. Even if you are supplementing with iron, then your iron stores are not going to go up very fast. I mean, it's just you want to basically figure out, how can I slow down this iron loss, because you're going to struggle to get your iron levels up fast, even if you're taking the most highly absorbable iron, because you could be losing iron faster than actually put in your body. I will say, when you do have your period, ladies, it is definitely a great idea. If there's any time you're going to basically, I'm going to take extra iron kind of thing, maybe say you take blood vitality, and most of the time you take 2, but you bleed a lot, then you might want to consider, like on the days where you're having a period bleeding, actually maybe take 3, because you can greatly increase your iron uptake when your body is in a state of bleeding during that period, the menstrual period time. The absorptive capacity of the body is in fact much, much better. So you can get a little jump start in there, given that you are losing significant amounts of blood during your period. So another way, or another reason that your iron levels may not be going up as you would like, is if you run a lot. So running can deplete iron stores, which is basically every time your foot hits the ground, boom, 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 you're actually losing. It's called footstrike hemolysis, and you're actually losing red blood cells. You're losing the iron that's in there, and basically the red blood cells are essentially shattering when your foot hits a strong force like cement, asphalt, track. If you're just like running on the grass, probably not be that big a deal. But any hard surface, you're going to be losing via hemolysis, shattering those red blood cells iron. So if you run a ton, this could be a place where you're losing more iron than you're putting in, or why your iron levels are going up more slowly. Even just the jostling of your kidneys and your bladder when you're running can deplete iron levels. Also, I would mention this related to runners. When you're supplementing with iron, you really want to consider that the iron deficient runner, there's a study done that person who took iron supplements within basically a 30-minute time frame of their morning run, if they ran in the morning, they absorbed 40% more iron, same exact supplement dosing, 40% more than when they consumed the same amount of iron after an identical run in the afternoon. So basically, there's this protein hepcidin that gets upregulated with exercise, and so it slows down iron absorption and makes it much, much more challenging for you to get enough iron in. Also, in the morning, this hormone / protein seems to be downregulated, which helps with iron uptake. So exercise, the key is take your iron before you exercise, take it in the morning, as opposed to doing it after exercise if you want to get the greatest uptake of iron from the supplement you're taking. All right, now number 4, I think we're at right now, is low thyroid function is another big one. So low thyroid function, it slows down hydrochloric acid production, which can basically decrease absorption of all manner of minerals. We're talking about zinc, magnesium, copper, calcium, but also iron. So low thyroid function is definitely a big deal related to absorption and utilization of iron stores. There was actually this one study in Hashimoto's thyroiditis patients. So Hashimoto's is a form of hypothyroidism. And the people who were medicated and given thyroid hormone support, they actually saw that their levels normalized. As their levels normalized, their ferritin levels also increased. So if you basically gave thyroid hormone replacement to these people, then you would see that iron absorption also increased, which is pretty awesome. Because if you have low thyroid and you have low iron, man, life is not going to be fun. You're going to be pretty tired. Body weight's going to be coming on you. Bowels are not going to be doing so hot. All right, another consideration is the health and I would say diversity of your digestive flora. The more diverse your flora is, usually the better your iron uptake is going to be. And if you've been taking iron and you continue to deal with iron deficiencies, then you really probably, maybe consider getting like a stool analysis. Talk to your doctor about potentially ways of making your gut flora more balanced, more robust, more diverse. Because a healthy digestive tract, man, that is of insane value for iron absorption and, of course, all the other things related to inflammation, decreasing oxidative stress, supporting detoxification, if your gut flora is intact and in good balance and as good diversity. So depending on the bacterial families present, it can make a huge difference whether or not you're going to absorb iron efficiently, or you basically especially if you take a lot of these standard irons, or if you're literally feeding pathogens within your digestive tract by taking iron that's easily broken down in the stomach and free floating. So you got to be careful on that because gut bacteria, they're so important for maintaining systemic iron balance and supporting iron absorption as a whole. But like I said, they can also, if it's the wrong ones, they can promote. The iron can promote, replication and virulence of pathogenic flora, or parasites that you do not want to have. You probably heard of like Shigella or Salmonella or Campylobacter. Any of those species, those can get a problem. Iron they love iron. They thrive off iron. So you want to make sure the iron you're taking is getting into you and not just hanging out in your gut. So more and more people, are dealing with these pathogenic flora. I see it all the time in these stool analysis we do, and it's some people don't even realize it. They have these just kind of constitutional symptoms, feeling just lack in their performance, and really it's these pathogenic flora that are just continually, chronically at work, and the body's having essentially a challenging time clearing them from the system. So this is all the more reason to, like I said, not use iron like iron sulfate or heme iron or iron bisglycinate, irons that do cause a lot of digestive stress. Because if your iron's causing digestive stress, then there's probably too much iron getting in there. There's too much free iron getting around, messing with your microvilli, feeding rogue bacteria. We got to be really careful with that. Whereas when iron is hidden in a matrix of a hydrolyzed whole protein, like inside a rice protein, it's not readily available for those gut bacteria. It's not readily available for those pathogenic bacteria to degrade and to consume as an energy source. So it's really important to remember that when iron is abundant, bacteria proliferate and they create biofilms, with much, much greater ease, which makes it that much more likely that those bacteria, we can't clear them. The body can't clear them like it wants to because these biofilms encase bacteria and allow them to just keep doing their damage over and over and over again. And that is a more common issue when you're using high doses, 100 milligrams, 120 milligrams, 300 milligrams of iron, just pounding it. That's just completely unnecessary. So iron is a big, big, big deal. How we use it, the right dose, right time, all of this because even low iron increases our susceptibility to infection, but too much iron does the same thing. And given bacteria that are rogue a bunch of iron, that's going to increase their likelihood that they're going to proliferate and cause infections and general inflammation in our body. All right, so finally, it also matters what type of iron you're consuming, and iron taken up, like I was mentioning before, by like a hydrolyzed rice protein complex. That really is the most efficient way of using it. I have not seen anything more efficient, more consistent in my patient population in the last 12 years. And that's, thousands and thousands of iron doses I put patients through, because iron deficiency is so common. And if you're watching this, you probably are well aware, man, I wish I wasn't dealing with this, but I am, and I don't want to get over it. I just talked to an individual today who's been dealing with iron deficiency for like 8 years, and no answers. And it's like, well, the answer is super easy. We just got to get your iron levels up, and you're going to feel amazing. But they just been pounding essentially the wrong type of iron over and over and over again. And literally, they started about 5 days ago, and they're already noticing a difference, which is just awesome. So get the right iron. Hope this helps as far as ways or reasons maybe your iron isn't going as fast as you want it to go up. Got to look at those root causes. And, in the end, you don't want to have to take iron for the rest of your life, right? If you need iron, you want to take it because it's invaluable to have enough iron. Otherwise, you can't shuttle oxygen around to your body. But at the same time, it's best to figure out, okay, is it for my periods, I'm bleeding too much? How can we balance these hormones out? I don't suggest birth control. I would find another route. That's not a supernatural route. But whatever your doctor is working with you on there, is it my running? Is it if my levels aren't going up fast enough? Maybe I need to think about running on softer surfaces, or more grass, or trail running kind of stuff, less asphalt, cement kind of thing. Maybe I need to think about the timing. Am I using my iron in the morning, first thing before exercise, or am I been taking it in the afternoon after exercise? And that's not giving me the same absorption capacity as it could in the morning. But there's so many things to think about. So get your iron levels up, enjoy the energy, the vitality, the vigor that comes from that, and I'll see you guys next time.